Assalamu alaikum wa rahmatullahi wa barakatuh, our viewer. It's your program once again, Healthy Check, a program where we discuss health issues regarding our health, of course, and we bring experts in different health fields to help us understand or overcome a few problems that disturb us in as far as our health is concerned. We are still continuing, just like in the previous episode, to go deep into candidiasis. And in the previous episode, I tried to define what candidiasis is, and our doctor, the one that we brought in the previous episode, who is again managed to come today, try to enlarge a bit more on what candidiasis is, and gave us a few types, of which was vaginal candidiasis, which we went deeper into explanation, and I believe you understood what vaginal, the causes, the prevention, and the treatment of vaginal candidiasis. He mentioned another type, which was oral candidiasis, which we didn't dive deep into. So that's the very reason as why I had to invite him today. He is Dr. Baker Akaturinda. You're most welcome.
Thank you, sir. Thank you.
Dr. Baker, you have unfinished business.
Yeah.
That is, you mentioned of oral candidiasis in the previous episode, but because we had vaginal candidiasis explained, we didn't have enough time to go deep into the oral candidiasis. Define and explain a bit further what oral candidiasis is.
Yeah, thank you, moderator, once again. Thank you for inviting me here, like you say, to do the unfinished business.
Yes.
It's very important because last time we were discussing the candidiasis, we discussed the vaginal candidiasis, and I mentioned myself and said there is another type called oral candidiasis, which affects the mouth cavity and also the throat and also esophagus.
So oral is within
the mouth cavity.
The mouth, okay.
Yes, yes. Unlike vaginal, which is in the private parts, this one is in the oral cavity, the mouth cavity. And it is also a serious disease which we cannot overlook, which you have to take attention onto. Once again, it is caused by the same fungal infection called Candida albicans.
Okay.
C. albicans is the causative fungal pathogen which causes oral candidiasis.
Okay.
I can also mention this and say it's also known as oral thrush. So the person should not be so surprised.
So one should not be disturbed if he finds that medical term somewhere else.
Yes, oral candidiasis.
They are referring to the same
thing.
Type of candidiasis.
Yeah, the same thing. Yeah.
Okay, then now, doctor, this takes me to the signs and symptoms. How can one know that he or she has oral candidiasis?
Yeah, thank you so much. Thank you so much. Now, oral candidiasis also manifests in different ways. But I don't know, I think at one time we had some picture our producer showed some time back.
Yes.
One is a healthy tongue.
Okay.
It has no lesions, it has nothing in it. It is normal as supposed to be. Now, the another one has candidiasis infection, or also known as oral thrush. So those are the typical signs that you can see when a person has oral thrush. As soon as you see those ones, don't think of that they have bewitched you. No, it's not witchcraft.
Okay.
It is called a yeast, a fungal infection, and typically that takes us to thinking of the Candida albicans as the cause of this. So that is the oral thrush. Now, among the signs and symptoms, as you have seen, you have the creamy white lesions. They are like whitish.
On the tongue?
On the tongue.
Okay.
And they are creamy. It looks like cream somewhere, somehow. So it is indicative. I can also mention and say, the picture was showing the tongue, but you can have also those lesions on the gums also, the gums of the teeth.
Okay.
You can have them because we said this affects the mouth cavity. The mouth cavity does not only have the tongue alone, it also has other parts. So it can affect anywhere.
Okay.
But usually they manifest on the tongue, but also it is possible to have them on the
gum.
On the gums. You can have them on the tonsils. You can have them on other the mouth parts, not necessarily the tongue. But usually the highest number of patients, they have them on the tongue. But you can also have them elsewhere on the tongue. Another sign which is common in oral candidiasis is the burning, the burning and the soreness of the gums.
Okay.
The person feels the gums are burning and they are red actually. They can be so too red. And the person feels very uncomfortable in eating food, you know, and the person tells you, I feel like not eating because when I eat, I feel difficult in eating. And also, in the cases when it has reached the esophagus, the gullet, you can have difficulty in swallowing. The way you saw how the tongue was looking like, imagine those sores are on the gullet where the food passes. I also have to mention and say, remember, the gullet is elastic.
Yes.
When the food enters, it enlarges. Then the first part opens, then the food enters, it enlarges as the food goes down.
Okay.
In medical terms, it's called bolus. After chewing your food, the mouth separates the clearly chewed food particle. It's called the bolus, like a ball. Then it puts it in the gullet. Then the gullet expands as it goes downwards.
Okay.
So I want you to imagine a body part which is already small, with all those lesions there, and the food is passing through. So it is very painful. A person will tell you, when I swallow food, I feel pain. Some of them, even when they swallow water,
they feel pain.
So it can be a sign of the candidiasis. Also, I cannot fail to mention bleeding of the lesions. Those lesions, when they have just started, they may not bleed, but like I always mention, most of us Africans are slow at caring for our bodies. You see a lesion and you say, this one will just go by itself. You see a lesion and say, it will go. Then it continues becoming severe. Okay. It ends up bleeding. So a person just bleeding from the gums, bleeding from the lesion on the tongue. So it is very serious, and we see these things like for us in the medical field. We see these things every day. A person has bleeding mouth and doesn't want to eat, has painful swallowing. They are serious presentations of this oral candidiasis. There are very many, there are very many presentations, but these are the cardinal, these are the principal, the major signs which a person can base on to say a person will be having the candidiasis. Okay, doctor, can you please tell us, can this oral candidiasis also reveal itself in more than one ways, or it has only one? Yes. Whatever, any disease reveals itself according to where it affects. So this being a fact that it affects the oral cavity, it may reveal itself in the oral, like we said, the creamy white lesions on the tongue and the gums, but also it can be seen when a person goes for long cold, we can have blood urine. Okay. In the case where lesions are in the esophagus and bleeding happens in the esophagus, not in the mouth, a person will swallow the food and it goes with the blood. So you usually will have blood or dark stained fecal matter. This will show you that there was some bleeding in the intestinal tract somewhere, in the gastro tract, somewhere. So it may not show, like you're asking, it may not show in the mouth, but in the esophagus, and you don't see there. So all you shall see is the dark stained fecal matter, indicating that there was some bleeding in the esophagus where we are not seeing. So through it can manifest in the mouth, but also through the fecal matter, which is dark stained from the bleeding in the esophagus.
You explained to us in the previous episode, Doctor,
Yes.
the causes of vaginal candidiasis.
Yes.
We need now to know the causes of oral candidiasis.
Exactly. Thank you so much. Once again, I'll repeat and say, we said in the vaginal candidiasis is caused by the Candida albicans in the vaginal canal.
Okay.
Now, in this case, it is Candida albicans or C. albicans in the mouth. I explained and said Candida albicans is a normal flora. Normal flora is a medical term which stands for the normal living organisms in our body cavities. They are there normally living there, not causing any harm. They just help us to maintain the acidity, which we call pH. Because you know, the mouth must be kept wet. So those organisms are there, the fungus, the what, they remain there happily and peacefully. Now, as long as they are disturbed by the reduction in immunity or of too much medications, these very Candida albicans will now turn out against the host, will turn out against the person in that part. So it will cause the fungal, the Candida, the oral candidiasis. So it is caused by the Candida albicans. It's a fungal organism which lives in our mouth normally. That's what causes it. Once there is a change in immunity of the person, then this very Candida albicans will cause the oral thrush.
Okay.
So it is normally there, it is there, everybody has, and it is causing no harm. But any change in immunity, harm is caused.
Okay. Doctor, there is a question again.
Yes.
Can one having oral candidiasis transfer this very type of candidiasis to anyone or a partner through sexual intercourse?
Thank you so much. This is very important. We cannot omit it. Very important. Yes. Oral candidiasis is in the mouth cavity. Okay. So it can be transmitted if a person has an intercourse, those who do oral intercourse, okay, they can have it, or those who kiss, a person can easily have it. But majorly, we usually see it when a person's immunity is lowered. It is possible for a person to kiss a person who has this, but once your body's immunity is strong enough, you may not have it. So basically we say it can be transmitted, but not much. Okay. As long as the other person's body immunity is strong enough, they may not have it. So oral candidiasis affects or disorders the body in a different way, and the vaginal candidiasis also in another way. Yes, yes. Okay, doctor, now prevent his or herself from getting oral candidiasis. Prevention is better than cure, what man said. Yes. Prevention, I say, is affordable. I always repeat, prevention is cheap. Okay. Prevention is for a wise man. Now, there are very many ways of preventing the oral candidiasis or oral thrush, if we want to say, and we shall discuss them here. The first one, since we are dealing with the mouth, yes, regular visit to a dentist is very, very key, because dentists know any sign which can be indicative of the oral candidiasis. Even before you see those thrushes, the oral thrush we saw on the screen, even before you see them, a dentist is able to tell that this is developing a lesion. So a regular visit to a dentist, it can do you good. Okay. We encourage, of course, you pay some monies for consultation, but regularly. Because we usually say if you have your money, at least every 3 months, okay, you will go and see your dentist. He checks you, checks your oral cavity, tells you what it is, and you prevent it. than spending a lot of money treating this. Then also, I cannot fail to mention and say maintaining health lives.
Okay.
I have always said, for our colleagues, for our friends who have HIV/AIDS already, how you keep healthy is to keep taking your medicines regularly and the way they tell you to take them. Now, these medicines will help to raise your body immunity, and you will also fight the oral candidiasis. Now, those who don't have the HIV/AIDS, I always encourage you people to make sure you avoid as much as possible, because most diseases take advantage of the immunosuppression. When a person is immunosuppressed, they usually get these oral candidiasis and oral thrush. So avoid HIV/AIDS. I repeat, avoid HIV/AIDS as much as you can. Those who have HIV/AIDS, please adhere to your antiretroviral treatment. ARVs, they are very good for your body. They help to boost your immunity. They try to put you back in line as a normal person who has no HIV/AIDS. I can't promise, like, you know, HIV does not cure, but the ARVs will help you to put you back online,
Okay.
to fight the infections. Also, since we are dealing with the mouth, we encourage oral hygiene. To brush our teeth at least twice a day. If you can't manage, morning brush, evening brush. We also say avoid cold food, cold foods and drinks. The picture on the screen is showing ice cream. It is very, very, very dangerous, and people have not taken it up. Okay, me personally, presenter, tell you the truth. Me, I don't take cold drinks. If I get food from anything from the fridge, I put it down first, cool down. Those drinks, I think I have to explain this for viewers to understand.
Okay.
Those cold drinks or cold foods, which are extremely cold, they enter into the mouth cavity and destabilize those normal flora, those Candida albicans. Remember, we said this Candida is in the mouth, normally living, happily living, cordially living with us. Now, when you put this extremely cold food, it will affect its living and make it to cause this oral thrush. Okay. So we should try as much as possible to avoid cold food, cold drinks. Those ice creams, they are not good. We actually discourage them. Those who take them, they are at a very high risk of getting this oral thrush. So we tell them to try to have your drink, let it be at cool temperature. If you can, you take warm water or warm drink. It is actually healthy. Even when you're using yourself, we advise to use warm water. It is better than cold water. Okay. Or if things fail, at least water at room temperature. It is very, very important. Also, I cannot forget to mention this. I want to say, let's treat any other candidiasis. Now, because the same causative organism of the vaginal candidiasis and oral candidiasis, it's possible when a person has vaginal candidiasis to easily get oral candidiasis.
So one can have both?
Yes. So we say, once you get one, please treat it very fast to avoid another one. So in a ways of preventing this oral candidiasis is treating any vaginal candidiasis. So once you get any vaginal candidiasis, you treat it very fast in order to avoid this one, because they are caused by the same causative organism. I also have to mention sugary foods. I explained the issue of the chocolate when I was explaining the cold foods. Now this is sugary foods as sugary foods. We always tell people, if you can, take very little sugar, very little. It is actually best not to take sugar.
Sure.
Yes, you get your tea, put some honey, you take that. It is very healthy, because a lot of sugars can make a person have the diabetes, which we mentioned some time back, I think the last episode. Yes. And now, once you have the diabetes, you'll be having high chance of getting this There's oral candidiasis. So encourage to avoid the sugary foods. Those chocolates, those biscuits, we can do with them, avoid them, have our local foods which are healthy, and you will live very. There are very many ways of preventing, but if we do those few which I've mentioned down here, it will help us to prevent this oral candidiasis.
I have tried several preventive measures, but I have failed. I have found myself having this oral candidiasis. How can I treat it? How is it treated?
Yes, again, the good news is that it is completely treatable.
Okay.
Very, very treatable. I always say, since it is a fungal infection, we simply give antifungals, and then after giving antifungals, we do practices which raise the body's immunity. So we always give antifungals, but also we tell people to take fruits,
Okay.
fruits and vegetables, and it will make them, the body, to be having enough soldiers, immunity, and themselves will go and fight against this infection. So we can give you the fluconazole and other antifungals, but also after giving those treatments, we say go and raise your body immunity by taking fruits, taking vegetables, avoiding sugary foods, avoiding too much red meat. If possible, you go now for white meat, chicken, fish, and that. Avoid too much red meat. And also avoid practices which lead to the diseases like HIV, AIDS, like cancer, like what. So we avoid the multiple sexual partners and other things. So we treat you and educate you.
Okay.
Yes.
Thanks a lot, Doctor. Of course, it's quite interesting as the program goes ahead. And Doctor, I'm going to ask you, for those people that are at a risk of getting, of diagnosing positive of this disorder, oral disorder,
Yes,
the
yes.
oral diagnosis, the oral candidiasis.
The first category are those with weak immunity, like HIV/AIDS patients. We always speak about this because we want our society to understand it. HIV weakens your immunity, weakens your soldiers, and this disease takes the chance. So HIV patients, they are at high risk. And anybody with HIV should be on the lookout because it can affect, can have this. Then also, diabetes patients. If you have diabetes, you are at high risk. So we encourage them to always have their medications taken properly, you have your anti-diabetic treatment taken well in order to maintain the sugar levels under normal levels. This will make you avoid having this oral candidiasis. Again, another type of people, another class of people at high risk are those with vaginal candidiasis. I explained and said they are caused by the same pathogen, so there are high chances of having vaginal candidiasis at the same time having the oral candidiasis. So we encourage those who have vaginal candidiasis to treat it very well to avoid this. There are other people, moderator, there are people who like going to hospital and asking for themselves treatments. They just go and say, give me this, give me Panadol.
Before even they check for
before checking,
testing or
before seeing
like
any
that.
Doctor, before seeing anybody, for them they feel headache, they just go and say, give me amoxicillin, give me Panadol.
They are doctors of their own making.
Of their own, yes. They have had their own doctors. So
that is why, doctor, before you go ahead,
yes,
the advice that is given to you, we still advise you. Before the doctor might have prescribed some medicines, you are advised to go and see your medical personnel, because we have different bodies, different blood groups. Some diseases might react to our bodies in a different way. Some might give different signs from our different colleagues. So we advise you, before you take any medication, go seek advice from your own medical doctor. Go ahead, doctor, please.
exactly. So Those who go and just get medication and they take them and they continue taking those medicines, the medicine is reaching the body and they destabilize the balance of these normal flora. I said normal flora are the normal living organisms living in our cavities of the bodies, normally, peacefully, and causing no harm. So once you take medicines, for us as doctors, I write for you medicines in consideration of your body, the reactions. I have at the back of my mind that you have normal flora in the body, so I write dosages which won't affect the normal flora, those living organisms. But when for you just a person just go and pick medicines on yourself from the pharmacies, you may take overdose or you take a dose which will heal you but leave this candidiasis. We have seen many people who have this oral candidiasis because of taking many medicines. So those who are in that class are at a very, very high risk. Another category of people are those ones with other oral conditions. It may not be oral candidiasis, but the person has dental caries, the person has gingivitis, the person has other diseases of the oral cavity. That one can predispose you to getting the candidiasis. In this way, that those infections will destabilize the balance of these living organisms in the cavity. So in doing so, it will eventually make them, these organisms, the normal flora, to turn around and cause the candidiasis. So those with other oral conditions, other oral diseases, are at a high risk of getting oral candidiasis. So we advise and say, if you have other oral conditions, or you have a patient who has other oral conditions, please be on the lookout for oral candidiasis. Tell your doctor to always check for oral candidiasis.
Thanks a lot, doctor. You know, time is not a good friend of ours. I could say he's an enemy, or it's an enemy to us, because whenever the program gets more interesting, the alarm starts. Time is up. But we shall bring you in the next episode, inshallah, if we have something that we have left in this program. And for our viewer, you have a connection or a link with us already in case you have something that is not digested in this program, that is not fully digested. Our email is africa@mta.tv. Send that question and I promise you it will be discussed and digested, inshallah. You might be having problems watching MTA. You might be having problems with a connection here and there, but I've got you covered. MTA has got you covered. It's everywhere you are. You have it on your phones. You have it on your computers. You have it on your smart TVs. Just go on your Play Store and download the application MTA International. You have 8 channels for you to watch, or go visit our website, which is mta.tv. You won't miss any program. In case you have missed this one, you have found it at its end or at its evening, just visit our YouTube channel, which is MTA for Africa. There you're not going to miss, or you're going to watch the programs that you have missed. I remain your host, Nambale Bashir, and until we meet in the next episodes, Assalamu alaikum wa rahmatullahi wa barakatuh.